Bob Burdikin of New Wave Therapy here. Today we're going to talk about our lights, how they operate, what the models are, how to take care of them, and all that good stuff. So stay tuned and here it comes. Okay. Basically we've got four models. We have our red light, which is our workhorse. It's a 660 nanometer specially selected diode that's put in this flashlight that it does most of the work. This is a light that we use probably 95% of the time with our clients, either in the field or in a clinical situation. It has 5 settings. It shows you the high beam there. There's a medium. There's a low. There's 2 flashings. There's the first flashing or pulsing, and then there's a second pulsing. All of these settings or modes are actually explained in the book or our manual that comes with the red light itself. Another thing we do with every time we use these, we go to this, we can get these at a box of these mainly at any type of pharmacy or drugstore, and they're just the alcohol wipes, and we take and we wipe it off every time that we use it from client to client. We get the inside and the outside of the edges, just like that, and we come in and we clean off the lens entirely itself. And we do that because we've done that for the last 5 years even. We haven't done it just because of any problems with programs we've got going now, but it's a matter of don't want to transmit anything from client to client. Another thing that we ask you to do once or twice a year is to take a little petroleum jelly, just like we've got here, and just a little dab of it, and you put it all around the threads, and you have to also get it on the little orange seal or O-ring, just like that, okay? And you put this back on, and we do that basically because these are waterproof units. So if you happen to drop it in a puddle or into a wet spot, it's always going to stay waterproof. Another thing that we like to show people is that we have other lights. We have a blue light, which is used mainly for skin issues. It's a situation that dermatologists are using it to help combat problems such as acne. They go in initially and treat the acne with the blue light. Again, this has a 5 setting situation. There's the low, there's the first pulsing, and the second pulsing. And once they treat it with the blue light, they come back in with the red light to help close up the pores and pockmarks that have been created by the acne. So it's a 2-step process. And then we also have a green light. Our green light, again, is a 5-function or 5-setting light. It does all the same things. It's just, again, it's set to a specific wavelength to do a specific job. And they're finding that it's starting to help with a lot of pain situations. It's doing wonders for people who have migraine problems. We're also getting input that the government is doing research programs with PTSD patients to help them cope better. And another program is being done that actually works with people who work on night shifts, being able to stay awake. So people that are having trouble staying awake, they're going through a program where they're using green light on them, and it seems to be working quite well. Now, we also found out during that same study that the blue light helps put people to sleep. So, and our 4th model is our 850 or near infrared light, and you'll notice you don't see anything. It's at a wavelength that you really don't see the light, but you will see a little red dot right in the center that is on. This light is only an on-off light. It does not do any type of 5 modes. It's only what we call a single mode or just on-off. Now, one of the problems that we've noticed is that you'll be using your light for a while and it'll start to look a lot dimmer than it normally would. So basically, you'll keep going along and you'll see it getting dimmer and dimmer, and then all of a sudden something just might happen on its own. In other words, it might start flashing. And it's supposed to start flashing. So we'll just give it a minute here, and you'll see what actually happens. These batteries we use are so good, they seem to recharge themselves when we turn them off. So it's really not working right. There we go. Okay, it's starting to flash, and that did it completely on its own. You'll notice I did not touch the button itself. Okay, so let's turn it off and turn it back on. Maybe it'll flash for us again. Okay, but you'll notice when you're working with people with your light or on yourself that you'll see it flash every once in a while. So, but anyway, what we do is we just take and change out the batteries. So we take the old batteries out. I just happen to have some new batteries here. Slip those in. Notice again, it's the pointy side goes inside, which is the positive side. And we screw that down tight. Because sometimes even if it's not tight, okay, if it's not tight, it will do the same thing, even with new batteries. So you can see now, again, this is much brighter. There's fairly similar to the one, so that's what happens. Anyway, that's our line. That's what we do. And we hope that you've enjoyed this little video.